Hello everybody, Dr. Keesha Ewers here, and I'm here to talk about calcium d-glucarate. Calcium d-glucarate is one of my daily supplements, and I sent out an email about it because I've had so many questions from so many people, both women and men, about what I use every single day. And when I tell them about calcium d-glucarate, they say, calcium what? And is that a supplement that I should be taking in place of my calcium? And how do I mix that with my magnesium? And what about that ratio? So I decided to do a Facebook Live video about calcium d-glucarate because, first of all, it is not a replacement for your calcium. And secondly, what I want to make sure people understand is what calcium d-glucarate actually is and why I use it every day. So calcium d-glucarate is a helpful nutrient that mammals have. It's found in vegetables, it's found in fruits. It's used by the liver to help get rid of our toxins. And it used to be, we could say, like my kids always said in the olden days, that we got enough calcium d-glucarate from our diet and our own production of it. But nowadays we have so many estrogen mimicking chemicals in our environment that we don't have the capacity to keep up with them. We've polluted our streams and our rivers and our oceans and our air and our soil to the extent that our bodies are really burdened with trying to get rid of the amount of toxicity that we're exposed to on a daily basis. And this doesn't even include the fruits and the vegetables and the meats that we eat that are also toxic, because you can make choices about those, whether or not you're eating organic or non-genetically modified. And a lot of times people will think, well, I don't eat GMO foods and I eat organic and I eat whatever diet I'm eating and so I'm good to go. But in fact, that's not accurate. And I'm going to tell you a little story. When I how old was I? I was in my 30s. It was shortly after my autoimmune scare with rheumatoid arthritis, and I had reversed that. I got breast cancer. I was diagnosed with breast cancer, and I didn't just all of a sudden get it. It had been developing over a period of decades. But I had found out, and this isn't a story I tell all the time, that my kids, two of my sons and my daughter, had been sexually abused by a babysitter. And I had left them with him during the day to go to a grocery store, thinking that they would much rather sit and jump on the trampoline with him in the backyard than sit in a grocery store with me and the baby. And lo and behold, many years later, my son came to me 15 years later and said this had happened. And I, of course, if you know my own story, I was sexually abused by a vice principal in my elementary school, and this was devastating to me. It was like the very worst nightmare, the inner ring of hell that I could possibly imagine as a parent, that I had subjugated my children to this horrible thing. Within 4 months of my son revealing this, I had breast cancer. Now, my genetics are set up for breast cancer. My mother's had breast cancer. It's a long line of women in my family that have had breast cancer. When I look at my own genetics, I go, oh my gosh, I'm perfectly set up for rheumatoid arthritis, which is in my family, and breast cancer. This is amazing. Of course, the genetic material that I'm able to look at with the testing I do with my own patients every day was not available back then. So, long story short, I went in and I felt a lump. I went in and I had a radiologist ultrasound it and said, you could see on the ultrasound there was this amazing, fabulous, healthy blood supply to this tumor in my left breast right over my heart. And I looked at that tumor and its blood supply and I said, I know exactly why I have that. And I said, give me 1 month. So I went home. I didn't see an oncologist. And I started tracking down the babysitter and doing some forgiveness work with him and my kids, and facilitated this remarkable healing process that was just incredible. So I wound up getting rid of my breast cancer within 1 month. 1 month. I went back in for my ultrasound And the little vessels that had been feeding that tumor were completely hanging there with nothing to feed. There was just this open black spot on the ultrasound image. And my radiologist, of course, was stunned and said, wow, so keep doing whatever you're doing. And so later, when I did my genetic testing, I found that I'm really prone to breast cancer. And I thought, gosh, I should see how well I'm doing with my estrogen metabolism, which is one of the big risks for breast cancer. So there's a great test available that you can do that looks at how well you metabolize your estrogen. This is not an estrogen levels test. It's not looking at your progesterone, testosterone, and estrogen. It's actually just looking at how well you metabolize your estrogen. So I had that test done. It's a urine test, super easy. I do it on my patients, again, every day. And I had the worst results. So I called the director of the lab that I use and I talked to her and I said, gosh, I've never seen a result so bad as this one. And she said, Dr. Ewers, I'm afraid that this is the worst one I've ever seen too. And I said, well, that's saying something because you're an international lab. And if you're seeing the same thing I'm seeing, which is the worst estrogen metabolism in your whole life, then I should probably get on this. So she and I got our heads together and looked at what I was doing. Well, I'd already reversed autoimmune disease, so I was already eating really clean. I was doing food sensitivity testing. I was healing my leaky gut. I'd already done a lot of the things that you would do. Forgiveness work, all of those things. What we discovered is that I didn't metabolize estrogen well from that test, and that I probably could start using something called calcium d-glucarate. So I instituted calcium d-glucarate into my supplement regimen, and that did the trick. The next time when I did my estrogen metabolism test, it was normal. It was just the calcium d-glucarate that did it. So here's what calcium d-glucarate does. It helps with your estrogen metabolism. Those of you that have already had breast cancer know that your doctors want you to be on tamoxifen as an estrogen inhibitor. And head-to-head studies with tamoxifen and calcium d-glucarate are showing that calcium d-glucarate can be just as powerful as tamoxifen for inhibiting your estrogen. That's huge. Another thing that calcium d-glucarate does is it lowers your LDL, or what we call your bad cholesterol. How does it do that? Well, it does it by actually helping your liver detox more efficiently. Up to 5 hours, actually, calcium d-glucarate gets your liver detoxifying. So I take it at night when I go to bed because in Chinese and Ayurvedic medicine, we understand that it's that early morning hour section of your clock that your liver's dumping, and calcium d-glucarate helps that happen. So it helps with that. By decreasing your LDL, you're actually decreasing your heart attack risk, because what those LDLs, if they're tiny, they cause, and you have inflammation on board, they cause the plaque to rupture and get underneath there. So I always say the little BB size LDLs are the ones that cause the problems, because you can have clots from that. It's not so much about the cholesterol as it is about the plaques that will erupt from the side of your gut wall. So it does that. It helps with weight loss because you're detoxifying more efficiently. It helps decrease, like I said, your estrogen for men and women. So here's another thing that I'm seeing a lot in my practice is men that are estrogen dominant. And what that means is they have more estrogen in their ratio than they do testosterone. That's bad. So for men, what that does is it makes them grow man boobs, and it makes them cry in the Hallmark commercials, and they get kind of flabby-abby, and they don't like it. Their libido goes down, their drive goes down. So this is a really important thing for men too. Susan, hello. So Susan Broughton has a question. Does it help if you're postmenopausal and low estrogen? Yes, because Susan, great question. What it's doing is it's helping that good guy estrogen that you're learning about in the Academy for Integrative Medicine, right? We want that one to be stronger, and we don't want you to be estrogen dominant. So remember that if your progesterone's low and your estrogen is only 3, then you're still estrogen dominant. So it's all about the ratio. All right, Susan says, I am currently on Niacet for LDL. Would it be okay for me to use it at the same time? Yes, they do different things, Susan. Fabulous questions. So one of the things that happens is I'm going to go through a little review of the liver. Whenever toxins are coming through the liver has 2 different jobs, and Susan knows this. She's in my health coaching program, has graduated and is now a health coach herself. So what I'm doing is I'm kind of letting you know, like, what is the liver for? Well, it helps you convert fat-soluble toxins into water-soluble toxins. And in the second pathway of that liver detoxification, it's actually doing something we call conjugation. And it's conjugating by taking that sludge or the toxicity to make it into water. It puts it into packets so that it can go from your liver to the bile to your gut and then all the way out. Well, there are certain enzymes, one of them is called beta-glucuronidase, that will go and separate the conjugated bond, and so that it reabsorbs the toxin, and it has to keep getting circulated, and your liver keeps having to deal with the same thing, and so you'll get non-alcoholic fatty liver disease, you'll gain weight, your cholesterol will go nuts, and then you won't metabolize your estrogen very well either. And one of the things Susan knows, and my other health coaches, is that if you don't do well with bioidentical hormone replacement therapy, like you gain weight, you get tender boobs on a low dose, it means your liver doesn't like the hormone replacement therapy. And it's not about the hormones, it's about the fact that your liver's not doing a good job metabolizing them. Beta-glucuronidase is actually separating that little packet of toxic bundle and with beta-glucuronidase, and then you're getting reabsorbed toxicity. So calcium d-glucarate prevents that conjugated bond from being broken by beta-glucuronidase, decreases beta-glucuronide so that won't happen. So it's a huge, important step that needs to be made, because those bonds are getting broken because there's such a huge level, like I said before, toxicity in our environment. So this will help women with mood, hot flashes, prevention of all of the estrogen-related cancers like breast, cervical, and uterine. It also helps men with increasing their testosterone levels, not necessarily increasing them, but helping you not have estrogen dominance. And the dosage will be different for each of these things. So Susan's asking me, so what's the dosage? So again, this is going to be another thing that is going to be not a one-size-fits-all. So for detoxification, which we started out talking about the liver and how important it is, a detox dose, a normal dose, will be anywhere from 500 to 1,000 milligrams a day. And again, I take it at night when I go to sleep because I want to help the liver detox. Now, for really decreasing estrogen and increasing your estrogen metabolism and making sure the metabolites are low so that you're not going to get cancer, I actually take 2,500 to 3,000 a day. Again, I used that urine estrogen test to be able to tell what my dosage should be. And so that's another thing you're going to do, is you're going to look at benchmarking some of these labs. I always say test, don't guess. So if your cholesterol is high, your LDL particle size is tiny, and we want to make it nice and big and fluffy so it's not dangerous, then you would look at, I do a test that looks at what's the particle density. It's called Boston Heart Labs, and it's fantastic for telling us what that information looks like. And then we can dose the calcium d-glucarate accordingly. So that's what you really want to do, is what are your benchmarking things? I have a patient who's got autoimmune hepatitis, about 3 of them actually, and their livers are backed up all the time with liver enzymes that are elevated, and we're working on getting them down. Well, calcium d-glucarate is going to be something I'm going to add in as soon as they can tolerate supplements. And so what you want to do is add that to your list if you've had breast cancer like I have. If you're trying to get LDL particle size big and fluffy, if you have weight that you want to lose, if you have some estrogen dominance, and the kinds of things that you'll know that you do, because again, test, don't guess, is that big waist size, you know, for women where you put on weight right in the middle, mood stuff where you're depressed and you're crying all the time and you can't figure out quite why, your memory is going away, your libido is heading south for the winter, you know, all of these things are going to be things that you're going to want to benchmark. Another one is going to be ammonia. So people are on high protein diets these days. We're trying to increase protein, decrease carbohydrates, and your kidneys are supposed to deal with getting rid of the toxins from eating a lot of protein. Now, it doesn't do a good job if your kidneys are overloaded with toxicity from the environment. Same thing as the liver. These poor organs of detoxification are so overloaded. So ammonia is supposed to be dealt with by the kidneys. Well, there are genetic markers that indicate when people have a hard time dumping ammonia. One of those genes is called the CBS gene. I have a problem with that. So I want to really take a look at this and say, okay, so how can I help my poor little kidneys deal with all of my protein? And guess what? In the research, calcium d-glucarate. So that's another one that you're going to want to take a look at. Another reason is if you're on a high protein diet and ammonia is being built up in your body, do you have gout? Are you really sensitive to foods? Are you having problems with things like oxalates and histamines? These are all indicators. Instead of having to restrict your diet down to nothing, which I have so many patients that are looking at the internet and finding all this information and getting so that they're sort of like on a shrinking iceberg of food they can eat. Calcium d-glucarate really helps deal with that ammonia that can cause some of this gut breakdown. So Virginia is on and she's saying, is this type of calcium for long-term use, or is it indicated to make pause after a few months? No, actually long-term. It's helping the liver. So that's a great question, Virginia. That's what you want to use it for, is to help your liver, and so you can actually use it. It's one of my forever ones because I don't really want to get breast cancer back. So remember, it's about critical mass. It's not going to be like if I get breast cancer again, it's not going to be because I didn't take my calcium d-glucarate. When I got it the first time, it was because I had a big grief in my life, a great amount of shame and some upset. And so that flipped on a gene that I already had in place. So if you've read my book, Solving the Autoimmune Puzzle, you know that I talk about these 4 corners of your puzzle. One of them is genetics, another one is past trauma, another one is leaky gut, and another one is toxicity. Well, calcium d-glucarate doesn't deal with all 4 of those puzzle corners, right? It's only dealing with the toxicity, the leaky gut, and the genetics, not the past trauma. So if I have a great deal of trauma that I'm not dealing with well, I can flip all that stuff on, and then it doesn't matter how much calcium d-glucarate I'm using. So this is why I always talk about doing all of it together at the same time. And you can use certain tests to benchmark, like I said earlier, like a urine metabolism test to see how you're doing with your estrogens. And that's the one I use every year. Okay, everybody, does anyone else have any questions? We're using calcium d-glucarate as our, this is the thing that we really want women to understand. The last Facebook Live that I did about a supplement, it was about inositol. Again, that one helps with testosterone, helps it metabolize properly for women so that they're not getting testosterone dominant. And that's one of the things that we see with fertility issues in women. Well, guess what? Calcium d-glucarate also helps with fertility issues with women. I give people that come in here, we've had so many babies at my clinic, and it's because we really help women utilize their hormones better. And we use inositol and we use calcium d-glucarate. There's a kit on the DrKeesha.com store that's called Breast Cancer Prevention Kit. And I built that for me. And so that's what it's for. And it includes calcium d-glucarate. You can also get it by itself. So Susan said, how is the urine test different than saliva? Great question. So Susan runs the saliva, adrenal, and hormone test for her clients. She learned this in the Academy for Integrative Medicine Health Coach Certification Program, that I teach them how to do this test. So Susan, what's happening with that test is we're looking at what are your estrogen ratios right now and what's your progesterone level, your testosterone, how your adrenals doing. But what it's not showing us is how you're metabolizing that estrogen. So whenever, the way I look at this is, like if you take your car in for an emissions test, what you're looking for is CO2 emissions, right? You're looking to see if your engine is performing efficiently and cleanly, and if it's not, then you get a fine and you have to go fix your engine of your car and get retested to make sure it's not dumping a bunch of garbage into the environment. Well, actually, your body has a bunch of different engines, right? So your brain is an engine, your gut is an engine, your adrenals, so the whole endocrine system is an engine, and we want to make sure it's going efficiently. So is your liver, your digestive system. So if it's not running efficiently, you're going to have a bunch of what we call metabolites left over. This is the advanced module of AIM, Susan. So this is where we start talking about this urine testing, is really looking at, is your body off-gassing metabolites into your body that are toxic and harmful the way your car would if it's not going very well. So that's what we're looking at. And so that's how it's different from the saliva test. Really great question, and I'm glad you wrote, aha, that means you understood it. So any more questions? I really want you women, particularly, and men too, because we don't want men that are low in testosterone, to really look hard at calcium d-glucarate as a helper for combating the amount of toxicity that we have in our environment that we call xenoestrogens. And what that is estrogen mimicking chemicals that appear in everything. The cans that you get a lot of your food from, the plastic bottles people are running around with, even though it says BPA free, what the industry does is they take BPA out and they add a different chemical instead. So anything that's plastic, your dry cleaning materials, the stuff you put on your fingernails, makeup that you put on your face, that what you're using is hair dye, and your shampoos, your body moisturizers, all these things have chemicals in them if you're not really careful. And those things are hard for your liver to digest, which is exactly what you're asking it to do. Anything you put on your skin, you're actually putting basically in your mouth because it's going into your system and your body has to digest it. So the calcium d-glucarate really helps your liver do its job so that you're not having a bunch of toxic metabolites left over that are recirculating over and over and over again in your system. So that's calcium d-glucarate, and you can get that. All brands are not created equally of supplements. That's going to put me on a little bit of a soapbox here. So the FDA does not regulate the supplement industry, and so there are certain brands that will do self-monitoring and self-testing to make sure that what's on the label is actually in the pill. And so the stuff that's on DrKeesha.com is called Functional Nutrients line. That's been vetted by me, and so that's why I encourage it. Susan says, I'm going to your website to order some. Okay, let me know how you do. I'm going to give a little warning to everybody. So remember, I did my urine metabolism test, and I found I was the worst I've ever seen in metabolizing estrogen. So I started taking 4,000 milligrams of calcium d-glucarate, which is the upper limit of what the research showed in breast cancer prevention. And I was such a bitch. And I'm sorry for the language, but there's just no other way of saying it. I was so cranky. And I could see it. Like, I could see from the outside that I was behaving badly and snapping at my husband. He was really the one that took the brunt of it. And I thought, wow, what's new? I'm taking this calcium d-glucarate. That's what's new. So I backed off on my dosage, and I went down to 1,000 milligrams. And then I started getting in my far infrared sauna regularly and doing some colon hydrotherapy and some massage. And I upped my dose while I was getting some help detoxifying. So what happened is remember, I had really bad results. And so there was a lot of estrogen that wasn't being metabolized properly. So I had a lot of toxins in my body, apparently. So when I started out on my calcium D-glucarate, boy, did it show up. And it was all estrogen kinds of symptoms. And so my body needed a little extra help. My liver just kind of offloaded everything. But remember that the gut has to get rid of it. And so I let my skin, which is the largest organ of detoxification that you have, help the gut and the liver. And so by doing far infrared sauna, some massage, and some colon hydrotherapy, I was able to begin to get to the place where I could take, I actually stay now at 4,000 every night, and now my mood is good and I don't notice it. But in those first 2 weeks, whew, it was not pretty in my marriage. I felt so bad for my husband. So Susan says, I promise I'll start low and go slow. Good. That's always a really, really good rule of thumb, is start low and go slow if you know you're sensitive to anything. So you want to make sure that you start low and go slow. And watch yourself. Like, how do you feel? Does your mood change? Do you get acne? Is there some kind of symptom that shows up? Then you want to back off, and like I said, far infrared sauna is fantastic, colon hydrotherapy, it'll help your liver. So that's it. If I don't have any more questions, and this video will stay up and people can watch it whenever, make sure you share it with people, because calcium D-glucarate is not expensive. It's a really fantastic aid for helping you to prevent any of those estrogen-related cancers and to detoxify in a safe way. Virginia said, are there side effects? Yes, I just talked about the side effects, Virginia. That if you start at a really high dose, remember 500 to 1,000 milligrams is the normal standard detox dose. But if you're really trying to get rid of estrogen metabolites that are putting you at risk for cancer, and this you would know because you did the urine estrogen metabolism test, which I do with my patients. You can contact me and I can work with you on this. If you go too quickly, then you're going to have irritability and you're going to have acne. All signs that your body's not detoxifying quickly enough, that your phase 2 conjugation pathway got upregulated too quickly and your body couldn't keep up with it. So your side effects are going to be if you're detoxing too fast and your body can't keep up. And that's going to be a lot of irritability, really. That's going to be the primary one. You're welcome, Virginia. All right, everybody, thanks for joining. Thanks for listening. Thanks for sharing with your community. This is, again, such a simple thing that you can do for heart health, for your weight, for your mood, to prevent cancer, and to really help you on high-protein diets to decrease ammonia in your body, which ammonia, again, it provides an environment that little bugs love to live in your gut. So it's a big risk factor for small intestinal bacterial overgrowth and yeast and H. pylori, all those bad bugs that can really affect your gut health. Ammonia is the environment they love. So you really want to get rid of your ammonia if you are prone to those bad bugs, and that's a whole nother video. And Shelley, it's good to see you. You're most welcome.